Hello viewers, I'm Dr. Farhad here, joining you from Philadelphia. Thank you for visiting my YouTube channel, Value Life. It is a resource to bring wellness within your reach. So subscribe for weekly updates on your physical, mental, and emotional wellness. I would now go over with you some of the information that you may find helpful to identify what are the risk factors for patients who actually may need treatment at home, and people who actually you have to be super careful if you keep them at home, because if they fall into a high risk category. So risk factors for developing severe disease include age more than 65, if you're diabetic, hypertensive, have history of stroke, you have any history of heart attacks, you have chronic lung disease such as chronic obstructive pulmonary disease or asthma or interstitial lung disease. And another very important factor added now is called obesity, which has been found to be a major risk factor. If you are immune compromised, you have chemotherapy, autoimmune diseases, use of prednisone or HIV, all these patients are considered high risk. If they are being monitored closely at home, you need to make sure that you stay informed about their condition. You know what their heart rate is, what their temperature is, what their oxygen level is, and what's their consciousness level is. They should be put in a separate area with the patient where they can get sufficiently isolated from others, but also get all the necessary food and other items of daily living. And you can also use telemedicine to do frequent visits with a nurse or with a doctor and show them the patient condition so that they can help you decide when you should go to the emergency. Patients who are recovering at home, they should focus on prevention of the transmission of infection to others, meaning they should wear the mask, they should wash their hands closely, they should have their own separate utensils, towels, and personal hygiene equipment. If there is any deterioration of their consciousness level, their breathing levels, they have chest pain, then you need to immediately call your healthcare providers or go to a local emergency room for further treatment. Patients should understand if you are going to the hospital and these patients have those risk factors, they might need admission and you may not be able to go and see them as frequently. So making sure when they are at home, you're doing your best to give them hydration, fever lowering medications, cough suppression medicines, and those general measures are usually given the same way in the hospitals. Most hospitalized patients, if they are not in ICU, they are not given hydroxychloroquine or azithromycin because these medications can have adverse interactions and can increase the risk of cardiac arrhythmias. We really don't routinely suggest COVID-19 targeted treatments because there is none. I mean, there has been no significant approval of any antiviral treatment. There are medications such as autoimmune related tocilizumab or Kineret treatments, but we are not using them on any in a routine basis. They are used only for very high risk patients, which actually are used with severe thoughtfulness. So the question is, if somebody was taken care of COVID-19 at home, how to discontinue their home isolation? Well, the choice depends upon how you are going to decide on which population you're talking about, if it's an immune compromised patient versus a non-immune compromised patient. The case is a little bit easier for non-immune compromised patients. So if you have tests available, then you can gauge that based on the test being negative, versus if you don't have the test available, then you gauge on the basis of their symptoms. When a test-based strategy is used, like you have the test available to repeat and see when you can discontinue the home isolation, which is currently a rare case because no state in America has actually those tests available. You want to make sure that the patient has no fever without use of fever reducing medications and their symptoms have improved. Their breathing has improved, their cough is improved, they don't have chest pain, and their breathing rate is not high. If you have pulse oximetry, their pulse oxygen rate is also. And then you do two tests about 24 hours apart. If two consecutive tests, which are preferably FDA approved tests that have been checked and are negative through nasopharyngeal swab specimens, then that patient can be released to stop the isolation. But that does not mean that you go out in the public. You still have to practice social distancing. but you can be among your family members, share the same utensils or the rooms with their family. When a non-test based strategy is used, that's when you have to actually be more careful, because you don't have a test to prove how to do. In those cases, well, first of all, you have to make sure that 7 days have passed since the symptoms first started in a patient. So 1 week of treatment is extremely necessary for you to be able to wash those tests. And once that has been taken care of, then you go by stopping fever medications. And if the fever medication have been stopped and there's no fever for 72 hours, then the patient can stop the self-isolation. That is about 10 days of treatment. Again, during this time period, contact your primary care doctors, urgent care, go on to COVID-MD or such websites where you can actually talk to a healthcare professional and get further help. Again, use everything that you have available to improve your hygienic conditions. Wear masks when you